Hi guys, this is Bilal from Canada. So today I came to the dentist to get my upper right molar cavity checked because ever since my last visit to the dentist, that was 2.5 months ago, I feel pain whenever the tooth gets into contact with anything cold like ice cream or cold water. And on top of that, I have to floss my tooth every single time I'm eating something because a good chunk of the food gets stuck between the upper right molar and the tooth next to it. So I was looking into the possibility of getting my cavity filled up because the filling is only $250 Canadian, as opposed to the root canal procedure that costs around 4,000 Canadian dollars with the crown involved. And there's no way you're not gonna get the crown if you get the root canal done, because in the root canal they completely empty the tooth till the end of the roots or the tip of the roots, and then they fill the tooth up and cap it up with a crown, and cost of that crown alone is $1,100. So the root canal procedure with the crown involved is 4,000 Canadian dollars. That's the price in which I could easily take my family to Pakistan from Canada and come back to Canada and still have it done in Pakistan in only maybe $25 to $50. The root canal procedure is what I'm talking about here. And there would be absolutely no compromise on the quality of procedure that I get in Pakistan as opposed to what they're capable of giving me in Canada. So the reason I visited the dentist was the possibility of getting the filling done. And if he was to give me the filling would be composite resin. That's the best material for filling. But the dentist examined the tooth and said, I'm going to show you shortly as well how bad it looks. It doesn't look very bad on the outside, but there is a cavity that has now protruded into the nerve. So the dentist did check. He did have my records from the 2.5 months ago exam that he had done. He had mine as well as Hina's. Hina is my wife. So he said that your cavity is so big that it has protruded into the nerve, and now since the nerve is involved, a filling is not a recommended procedure now, because if they do the filling, it's gonna push and exert pressure on the nerve and I'll have excruciating pain, and I might get back to the dentist with even more pain. So that's not recommendable when the cavity has grown big enough to involve the nerve within the tooth, which is very much the case here. So the dentist said there's no option other than the root canal. If you think that's expensive, that's something that you have to look into. If you think going back home to Pakistan and getting it done, there is an option. Most welcome, go do that. But here you cannot get away with a filling in this case. Yes, he said you can get fillings for other teeth beside that one particular tooth, because he said that yes, that upper right molar has a big cavity, but you also have cavities, not very big, they are just on the outermost layer of the tooth, like in the tooth enamel, and they have not yet deteriorated the enamel enough to get inside the soft tissue of the tooth or touch the nerve. It's just in the enamel, and if it is left untreated, those cavities will also completely eat up the enamel and get into the soft tissue and get in touch with the nerve and involve the nerves, and then you'll have to get root canals in those teeth as well. So he said that I can give you a quote for doing the filling of those cavities that don't look so bad as of now, and in my 32 teeth, that's 2 pair of teeth that require that kind of filling. So 2 cavities that he can take care of. So I've told him to give me a quote for that. And likewise, he said Hina's teeth also has a couple of cavities, so I'll give you 2 quotes separately, one for you, one for Hina, and just let me know if that works out for you, because as I told you, my insurance covers $1,000. So as long as the cost of the cavity fillings falls within that, we're good, we're covered. But anything beyond that, we'll have to pay from our pockets. So the dentist said that he needed a day to give me the quote, because he needs to see how many teeth are involved and how many cavities from the x-rays that he had done before, and that he would send me the quote via email. So I'm waiting for that quote to arrive for the fillings. But as for the bigger cavity that has the nerve involved, there's no way I don't get a root canal for that. And root canal here is very expensive. Then I thought, what if I just leave it as is? I don't get a filling, I don't get a root canal. What will happen then? He said, it's human body. I can't tell you the time, how long it will take for you. But for some people, it's a matter of weeks or a month that the nerve gets so affected that they feel excruciating pain and or experience swelling in their gums, because the infection has protruded to an extent that it has reached the tip or the root of the tooth, and then that's when it starts making the gums swollen. So he said, in your case, I can't tell how much time you have. You might have the time of only a few weeks, or it could be a few years. So based on that, what I've decided is that I'll just leave that tooth as is. If I get to a point where the pain is unbearable, I'll get back to the dentist and just have the tooth removed, because removing the tooth is also cheap. That's only $250. But then that, I understand, will compromise my eating experience, because one thing that used to be there and now it's not there, and you have to chew without that, and you're constantly getting the food rubbed against your gums. That will also wear and tear your gums eventually as well, unless you get a replacement of some sort there, and the replacement again is expensive. So I'm just hoping that before that point in time arrives where the pain gets very bad, I get to make a visit to Pakistan so that I can get the root canal done from there for that tooth. And the situation has been going on for a year now, and it's only been 3 months ago that the outer enamel started to shatter, and I could literally feel its pieces come between my teeth, and I took out, and it was the enamel breaking off from that tooth. So I'm just hoping that I have a lot of time before the nerve gets affected to an extent that the root becomes swollen or the gums become swollen, and I get to make a trip to Pakistan before that. So I'll just leave that as is. As for the other cavities, I'm gonna wait for the quote to arrive, and once it gets to me, I'm gonna get the cavities filled up, and that's going to be done with the composite resin I just shared with you. That's the best material for filling, and that's going to be permanent. But still, with the cavities filled, I have to take very good care of my teeth, like regular brushing, using a mouthwash, regular flossing. Like, I've got crazy particular about my oral hygiene ever since I saw this cavity build up, and now I have started to take very good care of my teeth, and actually my teeth don't look so bad. You can even take a look at them. They're not so bad. And as for the cavity, you'd not be able to really see, but still, no, I don't think you're gonna see that. But yeah, that has protruded into the nerve that's right here, and I'm just gonna bear with that. So wish me best of luck. Dental treatments here in Canada are extremely expensive, even if you've got insurance. Like, my work insurance gives me only $1,000 for that. There are some jobs that cover 100% of dental treatments, but I, as of now, don't have that kind of job. So that's what it is as of now. So wish me best of luck, and whatever I get eventually helps out. Subscribe to this channel for genuine, honest reviews on Canada. See you in the next video. Until then, take care. Bye-bye.